Okay. All right. We now have a quorum. Call this meeting of the Health and Human Services Committee meeting together. Ladies and gentlemen, we will have a meeting tomorrow at 2 o'clock here in 606. So, meeting here tomorrow at 2 o'clock. Okay, let's see. We are taking off for the, number 518 is coming off for this evening. Okay. Well, that doesn't work well. Hand me your pen. Okay. Okay. And the clerk is holding the office open himself. So if we want to keep the questions at a minimum tonight, ask them if they're pertinent to a bill. But, you know, so that we can try to get these bills in so they can move along and let the clerk go home. So let's start off with House Bill 264, Representative Workhouser.
Thank you, Madam Chair. Is it all right if I let Elmer Stansel join me?
Sure. As long as he's not long-winded.
Yep. And
you are working from the substitute?
I have, because there's been many, LC 7888S. Is that what you have?
Okay, just a minute.
I also have 7867.
Now, don't confuse me. Which one did?
The
What?
latest version is 7888S.
Where did that one come from? What? It's yesterday's? Do we have it? 7897S? That's, which one? That's it? Okay, it's 7897S, we right?
I don't have that.
That, okay. Right. Okay, tell you what, can y'all go out and come, let me pull another bill, check the bill. Josh, outside, y'all look at the bill. Thank you. Okay, Representative Stevens. That is House Bill 214.
Thank you, Madam Chairman, members of the committee. This is hopefully going to be a short bill. House Bill 214, and you'll be working with LC 337771S. All this bill does, currently under Georgia law, pharmacists can administer certain vaccines whenever you enter a protocol agreement with a physician in his or her health district. The problem is many pharmacists work in several different health districts, and all this does, very simply, is it removes the geographic limitation for the vaccine protocol agreements between a Georgia pharmacist and physicians, so that the Georgia pharmacist can enter into this protocol with a Georgia licensed physician. That's all that it does, so that we can give more vaccines in multiple health districts.
The physician resides in Georgia and is registered with the vaccine registry.
Yes, sir.
Okay, that he could reside in Georgia and not be, provide the physician resides in Georgia and is registered. He could reside in Georgia and not have a Georgia license.
This was language given to us by MAG.
Okay, is MAG here? Somebody from MAG? Okay, would you stand up, please? And come front and identify yourself and, I'm sorry, but
I'm Derek Norton with the Medical Association of Georgia. Our counsel isn't here. I believe this is correct, Madam Chair.
no, it's not correct.
Then I apologize. She's been working on this bill, not me.
Huh?
I apologize. Bethany's been working on this bill, not me, and our counsel.
Okay, can you
Give me 2 seconds to get some feedback, okay?
What? Okay, Betsy, hold on a minute.
Yeah, the physician is defined in this chapter as meaning a physician licensed in the state of Georgia. So when that word's used, it's
That's fine. That's what it defines. It means, okay. You're off the hook. Next time, have Bethany here. I mean, just because she has to pick up her new baby that's about 3 months old from the nursery, yeah, we have to work late. I mean, it doesn't count. I'm only teasing. I want Bethany to speak to me. She brings cute baby pictures. Okay, so this doesn't do anything as far as supervision in the local areas or anything else. It's strictly just about the one protocol.
Yes.
Okay, questions from the committee? Okay, questions from the committee? Okay, no questions. What is the? I've got a motion do pass and a second discussion. Who's 15? Oh, is that a second? Okay, I'm seeing no further discussion. Everyone in favor of the passage of the substitute to House Bill 214, say aye. Aye. Anyone opposed, no. Okay, the ayes have it. Thank you, Representative
Thank you, Chairman,
Stevens.
members of committee.
Okay. Okay, are y'all back with the right copy? Okay,
7.0.
all right. Are we now working off, this is the
LC 337897S.
Is that what we have? Okay. Okay. All right, has everybody got it?
Okay.
Okay, you're on.
Okay. All right. Section 1 just basically includes the local, these local service areas under, allows them to, or dictates that they have to abide by the same lobbyist disclosures as any other group who lobbies here at the Capitol.
Representative, I mean, I know about this bill
Okay.
and why you're bringing it. Can you very briefly tell the committee why we're moving a bill and
Okay.
doing things to our emergency providers?
Okay. I was trying to be real quick. Let me slow down.
Okay, well, I know.
Okay, so this bill came about because of a group of advocates who thought that our state felt like the way the state oversees how our ambulances serves the citizens could be better served. I did meet with all parties, all groups. My door's been very open, and we've met with a lot of groups who've had a lot of inputs, and that's why we've had a lot of versions on this bill. Appreciate the input that you've also added, which helps the bill tremendously. Do you want more detail than that?
No, that's fine.
Okay. All right. Section 1 basically says that those advocating for the emergency medical service communications program has to report just like any other lobbyist. So sections K and L has been added and makes it very specific who those folks are. Section 2, now my line number is going to be messed up, but each local coordinating council shall establish bylaws for its operation, conduct meetings and actions of its members. The department will approve those bylaws. Any employee, operator, contractor, or owner of an ambulance provider which provides service for a territorial zone or has submitted a proposal for a new service shall be prohibited from serving on one of these committees, subcommittees, or any group that is involved in the selection of ambulance providers for a territorial zone or from voting on any proposal for new service. Secondly, within 10 days of receiving the recommendation from the board, a provider may request a hearing on that recommendation. Thirdly, the decision is final unless an aggrieved party makes an appeal pursuant to the Georgia Administrative Procedures Act. And then yesterday, we added that all these councils are subject to the open meetings, and I appreciate you putting that in. Thirdly, on standards, the final section 3, and this is going to give them some time because these are some changes. So by July 1st of 2020, the department will make recommendations to each local coordinating council based on the territorial zone, taking into account for differences in geography, population, availability to emergency rooms, and other factors, so that each coordinating entity shall be treated differently, because Metro Atlanta is obviously very different than rural Georgia. It's going to give them a full year to implement these. So on or after October 1st, 2020, each ambulance provider in a territorial zone shall submit a quarterly report to the local coordinating entity detailing these three things: the number of 911 calls received by the ambulance provider, the number of calls answered by the provider, and then the response time from the time the ambulance unit was notified, and then details of that call response. And then these reports will be submitted back to the agency so that they'll be available for view. And that's the bill.
The advocates in many of the zones across our state have very good ambulance service. But
Yes.
just like in anything, there are some bad players. And in the areas where the constituents, their constituents, the people who use ambulance service, felt like there had been really bad service. And when you need an ambulance, you need it. You don't need it 30 minutes later if it's a true medical emergency. And they were running way over what is the sort of average acceptable time in getting to people. The other thing they said was that when they tried to attend meetings, they were kept out in certain areas, and they had to get a lawyer to get the records and Open Records Act. So I wanted to make sure by putting in that those meetings are definitely open to the public and that they could have their records. So that's a little bit of a,
Thank you, Madam Chair, for doing that. And again, by them making them do that, they've got to give advance notice when these meetings take place. So I appreciate that.
like that. Representative Newton.
Thank you, Madam Chair. I appreciate this bill in several ways. One of the questions I have, though, is the local coordinating entity has its bylaws, conduct of its meetings. The only time that if I'm reading this right, down on lines 97 and 98, is that the prohibition on an employee, operator, contractor, or owner of any ambulance provider is when they're involved in the section for a territorial zone or voting on new service. Is that right? I mean, they can participate in the day-to-day or the monthly operations
That is
of
correct.
examining the response times, discussing a mass casualty. They can be still a part of this local coordinating entity, correct?
Yeah, because they're the most knowledgeable, but at the same time, they shouldn't be involved in the
In the voting
process
on
of voting
those.
themselves on. Yes.
Thank you. I understand. Thank you.
Representative Petrie.
Yes, thank you, Madam Chair. I just want to make sure that I'm correct. So this is all existing language. The Board of Public Health is already in this authority
They oversee
position.
this.
None of that is not changing in any way, shape,
That
or
is
form.
correct. And the zones don't change. Currently, there's 10, the state is divided into 10 zones, so all that is
Right.
maintained the same.
None of that has changed. Thank you.
correct.
Thank you.
Is that it? Any other questions from the committee? Okay, Representative Newton. Oh, sorry. Representative Howard.
I'm trying to make sure I understand. The state has 10 zones,
The
Is
state
it-
is divided into 10 regions,
10 regions.
and those are the ones that select ambulance providers for each region.
Okay. So if an ambulance service owns a zone, then I'm trying to understand who would be responsible for.
So the committee could, so each entity could have, depending on the number of boards, they would have, the more typical situation is they would have like local EMS folks on the board. They might have a county commissioner.
Mhm.
They might have some ambulance providers on that board.
Right.
And so they would make up that council. And then that council makes some recommendations on who is gonna be their ambulance provider on the contract.
So the council will make the decision on who
Correct.
would carry the zone.
They oversee and make the selections.
Okay. So is there anything to make sure that there's nobody on that council that's in conflict with making that decision?
Well, currently, they're supposed to be recusing themselves from the votes, but this bill makes it very explicit that not only are they recusing themselves from their votes, they can't participate in any of the process, either committee or subcommittee, that leads up to those proposals being drafted or voted on.
Example, say if the chief of our fire department is on the council, can he vote? And we haven't, and he's starting an ambulance service within the fire department. Can he vote? Does he have to recuse himself from that
So he's a
vote?
county employee, and you're
He's
saying
a-
the county
he's-
is providing, or is he starting his own?
He's starting a ambulance service within the fire department for the county.
For the county. So county employees can be on it. I'm assuming go ahead.
The council makes recommendations to the Department of Public Health. So the Department of Public Health is the ultimate decider in the council's decisions. They make recommendations to the Department of Public Health.
So so the council is not the final.
That's right. They make recommendations to the department.
They make a recommendation. I
Yes, sir.
got you. Right, okay, that's good.
Okay, Representative Newton.
This was just kind of a follow-up on Representative Howard's, that if a fire department decided they wanted to become an ambulance provider as well, they would fall under the ambulance provider restrictions. So the employee, operator, or owner, if they were adding a service line, so to speak, there's fire protection, and then they wanted to add EMS or ambulance provider, then they would fall under ambulance provider.
That's
Okay,
correct.
I think it's a good disclosure.
Okay, that's the last of the questions. Any other questions? All right, what's the will of the committee? Okay, I have a motion to pass. Do I have a second? I have a motion to pass and second. Is there any other discussion? Okay, there's no other discussion. So, everybody that's in favor of the passage of the substitute to House Bill 264, say aye. Aye. Anyone opposed, no. Okay, the ayes have it.
Thank you, Madam Chair, and again, thanks for your input.
You're welcome. Okay, Representative, where's 10? Okay. Let's see. Representative Bazemore, House Bill 10.
Thank you, Madam Chair and committee. I'd like to present House Bill 10, LC 411630. And you should also have a packet in front of you, some testimonials and some information from a Congresswoman.
Okay, go ahead.
Okay. In the interest of time, I'd just like to explain the bill. It's a simple bill. The bill provides information and education on the use of tampons prior to dissemination of the product to our youth in schools and in hospitals, physicians and nurses, but not exclusive to those individuals. As you know, and you may have heard years ago, that toxic shock was a big problem, and we had people dying from toxic shock. The products that we use now still have an issue and a problem. If you look at the information from the Congresswoman, you'll see that there are, and the Congresswoman, is Mrs. Carolyn B. Maloney of New York, and she and Mr. Rangel introduced this bill in 2015. And the reason why it's still going on is because she wants to make sure that the ingredients that go into this product is safe for our children. And so as you see, there are the research regarding the risks posed by the presence of dioxide and synthetic fibers, chemical fragrances, and other components are in the feminine hygiene products. So I want to make sure that all of our children, young people, are very aware of what is in the product and what they are putting in their body. And also, I'd like to make mention that Dr. Gary McGibney, who is the Deputy Superintendent of Policy and External Affairs, has already agreed to implement the context of this bill into the curriculum, and he is working on his health standards right now. So I had spoken to him. He wasn't able to be here this evening. Oh, please come up. I'm sorry. And as he's coming up, also, I'd like to thank, and I'm sure you're aware that that Chairman Terry England of Appropriations has appropriated $500,000 as a grant to schools for feminine hygiene products, and also $500,000 to the Department of Public Health, which will assist in getting the word out. Because we do know that as we have younger and younger parents, this issue is not always in the forefront of their mind, or they have not even heard about it or concerned. And I understand there are labels on the products, but we need to make sure that our young people understand that this could be deadly. And I don't know if you've looked at the testimonials to see that a 13-year-old girl had died from toxic shock syndrome, a 14-year-old girl, and then others have lost parts. So this is an emergency, and it's very critical that we make sure that our young people understand.
Madam Chair,
Title again?
Deputy Superintendent External Affairs of the Georgia Department of Education, Gary
Okay.
McGibney. I just wanted to tell the committee that we have been working with Representative Bazemore for several months on this bill, and we think it's a great opportunity to heighten awareness of the issues that she raised, and we've already started working on some guidelines that we can embed in the standards. The health standards are undergoing review in the next year or two, and it was a good time for us to embed those standards and this information into the information that we're going to share with school systems around the state.
Okay. Okay, I have a question about that. It says a manual setting out the details of such course of study shall be prepared or approved by the state school superintendent. Is there a problem with the cost of that or the manual?
No, ma'am. We will be working obviously with the experts in the field, which would include public health, and I don't foresee a cost in doing that.
Okay, all right. Questions from the committee? So, Representative Newton.
Thank you, Madam Chair. Appreciate you bringing this bill. I do think toxic shock syndrome is a serious condition with the attention to sepsis and septic shock and all. This is one of the ones that in the emergency department we're watching for, and I appreciate getting those warning signs out. Seems like health class or whatever the current version is called is a good segue into it. Is there any association? I know that you mentioned some changes with HIV or AIDS and tampons. Is that just two things kind of in the same bill, or is there anything new in that?
That was just done because they were updating the language.
Okay. Thank you.
I have a question about that. Is it really that we want to have AIDS, or would it become infected with HIV? Huh? It would, I mean, okay, Representative?
I think you, Madam Chair, you raised a good question.
Okay, which microphone is it, Carla? Representative Brennan?
You raise a very valid question. HIV and AIDS are totally different.
and HIV, becoming HIV positive as before developing AIDS. So how would you change that, Representative Brenner?
After the word "and" on line 16, I would add HIV and that's what and acquired immune. I would spell out HIV, the human, can't remember the acronym, human whatever.
You better come up with it.
I'm
or-
sorry. My brain died 3 hours ago.
Okay. Representative Cannon, can you?
Human immunodeficiency virus.
Betsy, did you get it? I did. Do we need to, Representative Cannon, since you're the expert on this, do we need to leave in the AIDS?
Yes.
Yes, for both of them?
Yes.
Okay. So, okay, at the proper time, would you like to make that in all the spots where it has that?
Sure.
I would think it would fit. It's in the first part. Can you look through it and see? Or Betsy can work on it, and you can check with Betsy for an amendment. No, not now, but can you check with Betsy? We'll
Sure.
need to change it. Okay. Representative Douglas.
Yes, at the appropriate time, Madam Chair, I would like to make a motion.
Okay, let's see if there are any other questions. The committee, are there other questions? Representative Petrie.
Yes, I have a question. So line 51 mentions toxic shock syndrome is rare. How rare, and down in line 59, it mentions 17 per thousand. So where's that data from, sir? I don't know if you, or to the sponsor as well. Where's that data from? So I'm trying to discover how frequent this issue is.
Representative Basemore?
The only information that I obtained was the information that is in the bill right now. But even if it's one, it's too many.
No, but I'm trying to understand the degree of, your bill speaks to it as being rare. So where's that, so you've answered my question, the 17, where is that information from? Where is it coming from?
I
Is
think
it-
the
is it-
CDC,
Is it reliable data?
Ledge Council gave me that information to put in the bill from CDC.
CDC, the source of that data is from the CDC. That's what I'm trying to understand.
okay. Representative Henson? No, pass? Someone else? No, okay. Are there any other questions from the committee? No? Okay, so, we lost our school, the chairman of the, public education, the representative. So you see no problem with this being implemented throughout our school systems across the state?
No, ma'am. And we'll do it incrementally, first with the information campaign as we develop the manual, and then the health standards, which will be reviewed in a year or two. It'll become embedded in that, so it'll be rolled out incrementally. But we see no cost or any problems.
With this across our school system? Okay, and I noticed on the back part that says that physicians and nurses licensed are encouraged, so this is not in case some young person gets it and doesn't get the instruction on it, then there's no recourse, or repercussions against the healthcare provider that doesn't provide it.
That's correct.
Okay, I think I had somebody that, Representative, there are no other questions. Representative Dimitri, you,
I would like to make a motion that we do pass House Bill 10.
okay, okay, House 10, do I have a motion? Okay, and we're gonna we have a motion and a second. Now we have the amendments, the two places.
Thank you, Madam Chair. I would propose amending on line 17, prior to the spelling out of acquired immune deficiency syndrome, I would add human immunodeficiency virus, parentheses HIV, and then it would go to acquired immune deficiency syndrome, parentheses AIDS. So it would be human immunodeficiency virus, parentheses HIV, infection, and then on the next page, on lines 27, 31, and 36, I believe we could just add HIV before AIDS. We could HIV, comma, AIDS. So it would be
Does that get it, Betsy?
pretty much on those 31 and then 36.
That's your motion. Do I hear a move on Dr. Newton's motion? So moved. Do I hear a second? We have a motion and a second. Everyone in favor of the amendment as read by Dr. Newton and approved by Betsy, say aye.
Aye.
Anyone opposed? No. Okay, the ayes have it. It's amended. Now let's have a final vote on House Bill 10. It would be a substitute to House Bill 10. With the amendment added to it, goes out as a substitute. So is there any further discussion on the bill? Okay, all right.
Did you correct line 36 also?
Mm-hmm.
Okay, I'm sorry, I didn't hear you.
27,
And-
31.
Okay, that brought up something else. Betsy, do we need to add HIV and AIDS to line 4?
No, line 4 is just the title, and that's identifying the code section that it's amending, which currently says AIDS.
AIDS, okay, that's fine. Okay, any other questions? All right, seeing no other questions, everybody in favor to the substitute to House Bill 10, say aye. Anyone opposed, no? Okay, the ayes have it. Thank you.
Thank you, Madam Chair and Committee.
Okay. Representative Bodie. Representative Bodie, you trying to get a job at the new sports research center if we get it passed?
No, Madam Chair.
Just teasing,
I
just
know,
teasing, because there's hospital people in here.
Well, Madam Chair, first of all, I appreciate the committee hearing this resolution again. If just give a brief background. This is the third time I'm here. The first time in 2017, we had some issues because the bill only dealt with heat strokes. However, we came back last session and we added in there other injuries to the list of what the study committee could examine, which is one, cardiac arrest or any other sports-related injuries. That was a bipartisan effort. The bill passed quickly out of this committee. It got hung up in rules, so that's the reason why I'm back here today to ask for the favorable support of the bill once again. Basically, the title of this bill is the Johnny Tolbert III House Study Committee on Heat-Related Injuries, Cardiac Injuries, and Other Sports-Related Injuries. The reason why I'm bringing this bill, Madam Chair and members of this committee, in my district in 2016, a young man named Johnny Tolbert III died from a heat stroke during practice for a youth recreation team at Welcome All Park in South Fulton, Georgia. Also in 2015, Burke County High School football player Roderick Rod Williams died shortly after football practice in Waynesburg, Georgia, from heat-related injuries. Also, we had a young man to die back in 2014. His name was Jeremy Nelson. Jeremy Nelson was 12 years old at the time, and he died from cardiac arrest while playing for an all-star basketball team in Gwinnett County. His father, and I'm quote directly from what his father said, I don't even know if my wife's fully recovered from this. And he goes on to say, we have to do anything to save these kids. So what my bill is going to do, the resolution, is to put together a 5-person study committee to look at the issues, why we keep having these deaths, why this keep occurring, and what we could do to keep this from happening. Just to give some of the stats, the Center for Disease Control estimate that we have 1,442,533 injuries occurred among high school athletes participating in practice or competition, football, wrestling, soccer, basketball, baseball, volleyball, and softball, with the majority of these injuries and deaths occurring from heat stroke and cardiac arrest and other injuries. So what this bill or resolution would do is try to tackle that issue, deal with it head on, get the people in the room that know what they're talking about, physicians, experts, to see how can Georgia not be in the top 5 for heat-related deaths, but we could be in the lower 5 and not have any deaths at all from heat stroke and cardiac arrest. I'll yield for any questions.
Okay. Do we have any questions for Representative Bodie? Okay. Representative Drenner, if you got a question? No. Okay. No, I don't see any. Wait. Sharpter, Representative Sharpter.
Oh, thank you. Also, thank you for bringing this bill. But on line 13, it's probably just a typo that we can work on later. I think it's got basketball a couple times.
Yes, that is a typo. We could amend it and strike it out right now.
Okay, I didn't know there was special basketball.
No, it's not. I'll talk to Ledge Council about that. I think they double up.
Oh, come on, Representative. That's for those people that, do the ball so fast that it seems like there's 2 balls around. Betsy, if we make that correction now, does that hold it up, or is that a Scribner's correction?
We can do that.
Okay, it's a Scribner thing. So I can go ahead and sign it so it moves on.
I mean, you don't want to fix it right now?
Well, will that hold it up? Do we have to have it?
I mean, I can send it back to the office and try to get it before 7:30.
No. Okay. All right. Can we have your word that when it moves across that you will correct that?
Yes.
Because if we're not, it's going to have to go, and we'll be holding the clerk's office up, and it'll hold the bill up.
Okay.
Okay. Don't use those sharp eyes again, please.
Oh, I know, it's sharper.
I know, it's sharper. Okay. No, thank you for finding it, but you just need to correct that before it goes across. Who's doing that?
Well,
Who? Oh,
I was gonna make a motion.
you gonna pass? You ready to make a motion? Sure. Representative Newton.
I'd like to make a motion to pass.
Okay, I have got a motion and a second. Does anybody have further discussion on that bill? Not, everyone in the favor of the passage of House Resolution. Well, wait a minute. This is a House resolution. It's not going back.
No.
Okay, we need to make that correction now. This doesn't have to go across
exactly.
crossover day.
Yeah, crossover doesn't
Okay,
affect
I'm
it.
tired. Okay, Representative Sharper, we got a motion for due pass and a second on the bill. Now, if you would like to make a motion for the correction.
Okay, thank you, Chairman. I'd like to make a motion for the correction in line 13 that we strike the second basketball.
Okay. I'm not going to ask for discussion on that one. We got a motion and a second. Everyone in favor of that correction, say aye. Anyone opposed? No. Okay, the ayes have it. Now we're back to the main bill or the main resolution. Is there any further discussion? Seeing none, everyone in favor of the passage of House Resolution or the substitute to House Resolution 259, say aye. And opposed? No. Okay, the ayes have it. Thank you.
Thank you, Madam Chair, and thank you, members of this
So-
committee. Thank you.
It probably won't be on crossover day. It'll be down. Yeah, that's it. Okay, all right. Last but not least, I'm carrying House Bill 370. That's LC 33789S. Okay. This came about because in Clayton County, there seems to be a lack of physicians. Their EMS, the county's EMS system is getting many, many calls that were medically related and did not really need for the patient to be transported to the hospital. If a nurse could intervene, advanced practice nurse could intervene and, maybe order medications for a diuretic, or they could check their blood pressure. Maybe they were out of their blood pressure medication and they could, get them an order. So that's what brought this about, because they are trying a new system by putting nurse practitioners in their ambulances to answer these frequent flyers and trying to, maybe keep them out of the emergency room. So they've been doing that, but technically their lawyers and all thought that it was not implicit that they could order medications and so forth. And so this is making it very specific. They can order a 14-day supply of drugs. This is because they don't want to order 30 days and in 30 days just having the person calling the ambulance service again and getting another 30 days and just letting the ambulance service be their medical home. We really want them to get into a medical home. So you'll read it down. The nurses can't order any radiographic imaging, diagnostic studies, medical devices, so forth. And they need to refer the patients to a physician or to a federally qualified health center. I think many of the patients lack funds, and there is a federally qualified health center there. They do treat people for free. They treat people on Medicaid. They treat people on a sliding scale of very little money. And sometimes I think it may be one of the best kept secrets we have in this whole state, because we have 225 federally qualified locations across this state. There's only 35 counties that do not have one, and they take all comers. Insurance, they have physicians. They can get physicians often quicker than we can get them into rural areas, because they quickly pay off their medical loans, and they also pick up their malpractice cost. So it is a very good place for young physicians to start out in life and practicing. So that's the bill. Questions? Everybody else is tired. Oh, okay. Okay, Representative Newton.
Thank you, Madam Chair. One of the questions, obviously, the 14-day supply could be something as simple as a 10-day supply of antibiotic for an ear infection, or
something that the nurse practitioners can order.
Okay, okay. And then do this have to be under the protocol? You mentioned the full-time physician medical director.
Right.
Is that the nurse practitioner would be, advanced practice registered nurse would be working under a protocol with that full-time physician medical director?
Yes, with the medical director.
Thank
It
you.
is with a very specific protocol.
Thank you.
Yeah. And they can't order narcotics or anything like that. Pot? And try the ambulance service. You might get by one time. So, I mean, people say, well, is it going to encourage it? There are already frequent flyers because of lack of knowledge where to get help. This may not work out. They may still have frequent flyers, and, but it's worth trying a new kind of service. It's worth, let's see if this works, to maybe divert the frequent flyers from the emergency room. Okay? Any other questions? Okay, Representative.
This is the appropriate time I move due pass.
Right, it is appropriate time. Thank you. Do I hear a second? Okay, I have a due pass and a second. Any further discussion? No? Okay, everybody in favor of the substitute to House Bill 370, say aye. Aye. Anyone opposed? No? Okay, the ayes have it, and we are adjourned. Thank you very much.